Hello, my name is Senita Portlock, and this is my presentation on the interactions between autism and exercise, or more broadly, physical activity. So, first, we'll start with our DSM 4 criteria. It's my understanding this doesn't differ greatly from the DSM 5 criteria. That first being social communication and interaction deficits. Then we have restricted and repetitive patterns of behavior. So that's where things like cognitive flexibility, set shifting, or task shifting become relevant. It's also important that these symptoms develop early on for the individual. Um, our next criteria is that it's clinically significant impairment to your ability to function socially, occupationally, and more broadly with the way that society is currently structured. And lastly, these impairments can't be better explained by other intellectual or global developmental delays. So, separating out maybe some of those common comorbid disorders that come along with autism. And I have this graphic here because I think a lot of the time our common understanding of autism is at these two different poles. So there's more understanding of autism being a spectrum, but a lot of the times we think about it in terms of people who have very high support needs and very low support needs, or something like that, where it's very from one end to the other. And as we know more about autism, it's better understood as a spectrum that looks more like this. So we have our different symptoms of the disorder, and an individual might feel those symptoms to varying intensities. So, two people with autism might have very common symptoms and feel them to varying intensities. And that's why some language like high functioning, low functioning, Asperger's is tied into that high functioning piece, may become less useful as we learn more about the disorder. I'm going to start with two experimental studies, the first of which will be on the impacts of physical activity interventions on physical and cognitive outcomes in children. The next one will still be about children, but it will be much more focused on the differences between structured and not structured physical activity and how that has impacts for social interaction and communication. So, looking at our first experimental study, we had two different groups, Group A and Group B. Both groups had the same amount of participants, so 11 boys, and all of the participants had been diagnosed with autism spectrum disorder. Their ages ranged from 6 to 12. The treatment intervention that was chosen for this study was table tennis, and it was facilitated by a professional table tennis player, and they also had other individuals involved in facilitating and volunteering who had some experience working with children with autism. Both groups received this intervention described down here. Group A received it for the first 12 weeks. Group B received the intervention for the second 12 weeks. And so that provided some information on the longevity of some of the outcomes that we saw in the results. Each of those different sessions that they had, 2 sessions a week for 70 minutes, we had a warm up. They focused on motor skills training. Then they have executive function training, group games, and then a little cool down period. So we can see here in the group games, we have some of that social interaction piece, executive function training, or maybe getting into that cognitive piece, judgment, self-control, those sorts of things, and then just motor skills training, since that seems to be a common deficit in individuals diagnosed with autism. And so when we look at the results of this study, we can see our biggest effect sizes are in these first four categories. So manual coordination, body coordination, strength and agility, and the total motor composite score. So just sort of aggregating all that information. So we have significant values here. We can see our P is less than 1% in all of these different cases. These next few categories, when we start talking about the WCST, that stands for the Wisconsin Card Sorting Test. And it's a common measure of executive function, specifically cognitive flexibility. When we start looking at the perseverative responses, so you start your Wisconsin card sorting test with a certain rules to how the cards will be sorted, and this perseverative response is looking at how well the participants are able to adapt and be flexible to changes in that card sorting, like the rules set up for that test. So it's really useful for looking at executive function, but also things like task shifting, or you might see it called set shifting. In my second experimental study, we were looking at impacts to social interaction and communication, and specifically how those things responded to structured activity. So again, we have two different groups. We have 21 participants in the experimental group, 20 in the control group. This is the number that did the experiment to completion, even though there were 50 recruited. We have a little bit of a younger age range here, 5 to 8. The treatment model in particular was the TEACH model, which is structured teaching with visual schedules and emphasis on routine. So our experimental group went through 12 weeks of the program, twice a week, 60 minutes per session, in total for 24 sessions, doing exercise that aligned with this TEACH model. So very structured. There were visual schedules presented to the children about what was going to take place, and it was very routine. Our control group, and this is what's sort of interesting about this study, they didn't have any specific intervention, but they did engage in regular physical activity. So this study really got to the impact of having structure and routine built into an exercise program for individuals with autism. And when we look at the results here, I know this is a lot of numbers, but I'm going to try to distill it to what's important here. We have our results for our control group over here. They did collections before, in the middle, or during, and after. Same over here on the right for our experimental group. And if we start looking at these numbers, we can see, okay, so they're starting off pretty much at the same place. Cooperation, all these different measures of social skills. But when we look at the differences between before and after for our experimental group, we experience a significant increase in their social skills overall, based on these different metrics. And in particularly, there were statistically large increases in their communication skills, cooperation, and self-control. And self-control in particular is interesting because it sort of gets into those inhibitory pathways that we talked about earlier in the course, and the ability to maintain those negative feedback loops. So the next piece is looking at a meta-analysis. And in particular, I chose a narrative review. Now, this narrative review doesn't really have an efficacy statistic. They didn't standardize for all the different sample sizes that existed in the literature that they reviewed. But later on, we'll look at a different meta-analysis that did do that. But I couldn't pass this one up because it had a relatively recent publication date, and it was focused on exactly what we've been talking about in the course. So it looks at those neurobiological underpinnings of exercise interventions for autistic individuals in particular. So we'll look at a few different mechanisms that they found might be involved in this interaction. The first is the reduction of neuroinflammation. Now, there's a wealth of information as it relates to interactions between autism and the gut microbiome and those sorts of inflammatory responses. But as we learn more and there's more interest, we're learning more about neuroinflammation and that as a feature of autism, specifically chronic inflammation of those neuronal circuits. So we have our sustained neuroinflammation. This occurs in multiple regions of the brains. And of note is this proliferation of these microglia, the pro-inflammatory markers, so those cytokines and chemokines, and the inflammatory signaling pathway activation. Here I have this little graphic. So we've talked about these microglia earlier in the course. And those cells can differentiate into our M1 microglia. So those are the pro-inflammatory or bad guys we've talked about. And then we have the M2 microglia, anti-inflammatories. Those are important in tamping down the ability for these M1 microglia to wreak havoc. And that ability is impaired in individuals with autism. So we have a lot of these microglia differentiating into M1 microglia at the expense of differentiating into these M2 microglia that are able to inhibit or control the harm that these can wreak on the neural system. And so, how does this relate to exercise? So, we've talked so much in the course on how exercise can play this attenuating role on that neuroinflammation response. So, maybe helping some of those microglia differentiate into the anti inflammatory kind so that we can preserve that inhibitory feedback loop or response pathway to inflammation in the brain. We've also looked at voluntary wheel running, specifically in rodent models, and how those reduce the proliferation of those M1 activated microglia, specifically in the hippocampus. And I really want to point out this voluntary word because that really gets into some interesting interactions later, because we've talked about the importance or potential importance of structured routines and physical activity for individuals with autism. But this voluntary piece ties into a lot of the studies on physical activity for individuals with autism, talks about satiety or the ability to exercise until the individual doesn't want to exercise anymore. So, how do you balance this need for structure and the importance of having that time to exercise for as long as you need to manage whatever behaviors you're experiencing? And then lastly, our narrative review talks about a study where swimming reduces some of these signaling proteins and cytokines involved in the immune response. Specifically, this one, interesting, is tumor necrosis factor, alpha, in VPA treated offspring. And that VPA treated, we probably, I think, I mean, I made the presentation, but we talk about VPA treated offspring because exposure to valproic acid, which is what VPA stands for, is a risk factor, prenatal risk factor for the development of autism in offspring or children. So it's very interesting that swimming can reduce some of that inflammation or that heightened immune response in individuals who have been treated with that risk factor for developing autism, um, which has a strong suggestion that that has anti-inflammatory effects. Just the physical activity itself can help tamp down some of that immune system response. And here's a little bonus. This one was just interesting going through the study. So there's increasing interest in the use of cannabinoids as an anti-inflammatory for those neuroinflammatory effects on the brain from autism. So the endogenous endocannabinoid system is a neuromodulatory. So we're getting into attenuating some of those differentiation between M1, M2, microglia, all that kind of stuff. And the cannabinoid system acts as a bridge between the immune system and the central nervous system. And it helps regulate brain homeostasis throughout development, so even into adulthood. And one of the studies in the narrative study found that moderate duration of exercise increases endocannabinoid levels in the brain and the blood and can trigger anti-neuroinflammatory effects of cannabinoid receptors. So this remains a little bit controversial in the literature, the ability to maybe exploit or use these cannabinoid systems to manage something like autism, but I could not go without mentioning it at least. So it's a bonus mechanism related to neuroinflammation. My second main mechanism is synaptic plasticity. So this one is really interesting because it's not just a really straightforward one. So we have studies that show that there's a density of spines similar for individuals with autism right after they're born. But those abnormalities begin to develop a little bit later as they reach childhood. So once we are reaching 5, 6, 7 years old, those differences in the density of spines begin to occur. But as I say differences, it's not necessarily more or less. These differences are really related to different regions of the brain. So we found a significant increase in dendritic spine density in the prefrontal, temporal, and parietal cortices and other brain regions in autistic individuals. So we have some of that increased. We have some of that increased connectivity. But other studies have shown we have some reduced potential for connectivity via decrease in spine density and complexity and branching in the dorsolateral part of the PFC, so a specific part of the prefrontal cortex, and in the hippocampus. So it's not just increase of connections or decrease of connections or complexity. Different things are happening in different regions of the brain. And then on top of that, those differences that they've seen in the different regions of the brain, there's some frequency or increased frequency in individuals with autism of spontaneous excitatory postsynaptic currents. Now, what the heck does that mean? So, that is referring to the firing of those neurons or transmission without sort of an intentional stimulation. And this makes sense in the context of autism because that could lead to constant or chronic state of hyperactivity in some of these systems and in synaptic pathways. And it seems sort of intuitive how that could contribute to feelings of sensory overload or sensory fatigue, even. So if you're just constantly firing, even in the absence of like some intentional stimulus, those systems are going to be hyperactivated. And then this graphic is just talking about LTP. So in autism, there's been marked lowering of LTP, or the potential to have strong connections across the brain. So the ability to get past this baseline of connection is lowered. But here we can see in some cases, this LTP is sort of going unchecked. So that really goes into what we talked about earlier in the semester, where more connections is not necessarily better. So LTD, or those long-term depressions, are important too in terms of facilitating synaptic pruning or dendritic pruning so that we can have efficient connections across the brain, not just more connections across the brain. So that's important too in terms of optimizing the transmission of information through the brain. Oh, and so here in my presentation, what does this mean? So exercise promotes LTP and synaptic strength overall. This has been shown in animal models specifically to rescue those impaired LTP functions in autism spectrum disorder by restoring balance. So we talked about how in these different regions of the brain, we might have more synaptic connections, we might have less synaptic connections, or complexity and length of these dendrites. But exercise helps sort of reach this homeostasis in terms of restoring a balance between maintaining efficient communication across the brain. And this is important because it can help with restoring that cognitive flexibility that might be impaired by that decrease in synaptic plasticity in the hippocampus and pattern separation, those sorts of things, which are common deficits observed in individuals with autism. And so here's just a little quote straight from the narrative review. Exercise regulates dendritic length, complexity, spine density, synapse density, structural parameters, those spontaneous firing, the firing across different regions of the brain, and all those different brain areas that are important for proper function. So notice that it doesn't say it's just upregulating, because different things are happening in those different regions. In some regions, we're going to have some pruning, sort of tamping down, controlling maybe some of those spontaneous firings of the synapse. And in other regions, we want to upregulate. So increase the amounts of connections or spots for connections and receptivity. My last mechanism is neurogenesis. So even though in that last little part, a lot of evidence indicates that autism is a disorder of synaptic dysfunction, there's more data that's emerging that's talking about how the dysregulation of neurogenesis precedes those impairments in synaptogenesis. And this might be an origin of autism, which makes sense. Like if this comes before those impairments to synaptogenesis and the connectivity across the brain, then it might be the real root cause or whatever. And here our VPA comes back up again. VPA exposure during pregnancy is a risk factor for autism. One of the studies looked at in the narrative review was on monkey offspring during early pregnancy, and that specifically not only induced autism-like behaviors in the primate model, but it disrupted neurogenesis once they were able to look at what was going on in their brains and the expression of genes that are associated with typical neurodevelopment. So we've talked about neurogenesis as primarily taking spot here in the dorsal raphe nuclei. Um, and we can see the connections this has to all these different regions of the brain, and also as a seat of serotonin production. So if we have dysfunction going on here, it is going to touch all regions of the brain. And so how does exercise act as a modulator here? So these are, we've already talked about. Exercise promotes neurogenesis and those systemically released factors. So those upstream factors like vascular endothelial growth factor and IGF, all those sorts of things. Endogenous endorphins become upregulated in the presence of exercise or physical activity. So that could help modulate that decrease in neurogenesis seen in individuals with autism. And excitingly or interestingly, there should be further studies looking into the promotion of exercise in pregnant women who have a high risk of developing autism due to that exposure to valproic acid or VPA. So we've seen that that's a risk factor for offspring developing autism. Um, and if you're interested, I believe, don't quote me on this because I'm in the thick of it and can't really look it up, but I believe that that's typically introduced through like medications that the mom is on, like sort of non-negotiable ones. I believe I saw something about like seizure medications and things of that nature. So that's a common entry point for valproic acid for moms, which we've seen could have an impact on the development of autism in children. And I love this little simple infographic because it just looked a little bit happier than the graphs and tables from the studies. So, how do you enhance neurogenesis? Through regular aerobic exercise that's going to upregulate your BDNF and your precursors. And also, interesting, engaging in social interactions. And that ties directly into one of the main symptoms and challenges of autistic individuals. So we talked about 3 different mechanisms: reducing neuroinflammation through exercise, supporting synaptic plasticity through exercise, and promoting neurogenesis through exercise, and specifically how that might relate to autistic individuals. So it feels sort of remiss to not talk about some of the potentially aversive effects of exercise on individuals with autism. Exercise is nothing if not a pure sensory overload most of the time. There's a lot going on when you exercise in terms of your breath, the way your body feels, depending on the environment that you're on. So, exercise itself could sort of contribute to those feelings of overstimulation and sensory overload that these individuals might feel, and might feel to a heightened state on the regular. In addition, novel or unstructured exercise routines might provoke anxiety. And anxiety is commonly comorbid with individuals with autism. So we already know increasing anxiety, increasing those release of cortisol could pose a threat to the HPA axis and its ability to complete that negative feedback loop. And lastly, I didn't talk about it a lot in terms of the DSM because it's not really one of the main criteria, but multiple individuals with autism suffer from impairments to their motor control. So, something like a complex movement during exercise might be frustrating. There's a specific challenge called dyspraxia, which is just related to motor control impairment. And that might elicit behavior regression. Regression, why? Well, if you aren't able to master or feel um, competent in the context of the exercise that you're performing, that might pose a threat to things like your body image or feelings of self efficacy and competence. So, doing too much or too intense movement might impact the ability to develop a productive physical activity regimen and adhere to it. So, like I said, I was going to look at a different meta analysis to sort of sneak that efficacy statistic in. So, I looked at a different meta analysis on the effects of physical exercise on autism spectrum disorders. And this study looked at all types of exercise. So, there were jogging exercise, there was swimming, horseback riding, stationary bikes, walking outdoors, all things. Um, and they separated those out through individual exercises, exercises, and they looked at these different metrics and the effect size on motor skills and social skills. And they found a significant difference in the type of intervention. It's not what I expected, though. So they found that there is more improvement in individual exercise for both motor skills and social skills. I totally expected group exercise to provide more of a boost to those social skills metrics on average, or the average or total improvement rate. But there were more improvement in those individual exercise, even on social skills. So it just sort of suggests that maybe the ability to optimize for the particular challenges and ranges of intensity for each individual with autism, because we looked at that little chart earlier. Two different people with autism could have completely different needs, even though they're facing the same challenges. Maybe the ability to tailor a program specifically to that person and their challenges is able to optimize that boost to these different um, skills, motor skills and social skills, more than would be possible in a group setting where you're trying to account for all the different needs of the people in the group. So I found that pretty interesting. And we have our dose. So we saw lots of evidence to support benefits, specifically in early implementation, long duration. So, why this long duration? Well, that ties to that satiety piece that I talked about earlier. So, the ability to exercise for as long as the individual feels that they need. And if you have a long duration exercise, even in the context of something structured, you're able to fulfill more of that need in a group or individual setting. Multi-participant. So we've seen how that could be a little bit equivocal. So earlier in my experimental studies, we definitely saw impacts from those being group-based interventions in terms of boosting those social skills. But in that later meta-analysis, there's some literature that suggests that maybe individual exercise plans or physical activity actually provides more of a boost to social skills and motor skills. So I highlighted that in a different color because it's a little bit equivocal there, whether multi participant strategies would be appropriate or not. Multi component, um, we saw that there's boosts based on structure. So having like very clear delineations between the different steps taken in physical exercise and how that relates to adherence and enjoyment and beneficial outcomes with individuals with autism. We've seen in multiple parts of the literature moderate intensity, so you don't want the movements to be too complex. Moderate to high frequency ties into also that duration and structure piece. So those might be the most effective parts of developing an appropriate dose for an individual with autism. Because again, everybody's autism is going to look a little bit different. Same challenges felt at different intensities. Last part is just a quick little thank you. Got my experimental studies cited here if you wanted more information on what went into those. My 2 meta-analyses. Big thanks to members of the Portlock family helping on proofreading. And of course, Dr. McNally giving us the background information to even be able to tackle something like this. So, great. If there's any questions, feel free to put them in the replies. I'll try to be as responsive as possible. And yeah, great course, great semester with you guys.